Good morning. Today we'll be talking about United by Unique, a patient-centered approach to treatment, which is a special program discussing the theme of the World Cancer Week. Thank you, Dr. Ekpo and Dr. Iwuji, for coming on the program. It's a pleasure to have you both with us.
Pleasure to be here. Thank you for having me.
Likewise.
Thank you. So, Dr. Ekpo, I'd like to just kick off with you. United by Unique, that's quite an unusual theme. Can you please explain to us what does that mean in the context of the World Cancer Week?
So United by Unique, it's a very interesting theme, and it speaks to what they've ended the second half of the theme with, which is patient-centered care. The goal of the theme is to educate everyone to realize that, yes, patients may have the same diagnosis, so they may have several people with breast cancer, but each patient's journey is unique. And that uniqueness should be recognized, should be acknowledged, should be intertwined with the whatever modality of treatment or treatment plan is being prepared for the patient. And once we are able to recognize that uniqueness, the individuality of each patient, we begin to formulate care around it. Patient-centered care is not new. It has been sort of a buzzword in the healthcare industry for a number of years. But it's good that in cancer care now, that really is becoming the goal and the focus, to recognize the individuality of each patient and therefore the individuality of their care as they progress through their cancer treatment journey.
So when we talk about being united by unique, what do we mean? And we understand the unique part of it now, but what does it mean to be united by unique?
So they're united in the fact that they all have cancer. They may all have that, they all have that thing that they're going through. But even in the fact that they are all united by that one diagnosis, be it for the fact that, well, they all have cancer or they all have the same diagnosis with cancer of the breast. But even in that, there's individuality in that. That's the whole, purpose of the theme, United by Unique.
Well, I think it's a very important one. And I think one of the critical areas in which being united by unique is the issue of patient-centered care. I don't know if Dr. Iwuji, you want to dive in here, explaining, perhaps to people who don't know, I don't think there are many who would be listening to this program and do not know what cancer is. Well, what is cancer? And then what is this issue to do with patient-centered care?
Thank you so much. So I think it is important that we just go back and review what cancer is. So cancer is basically when the cells in a particular part of the body start dividing uncontrollably, and they don't go through the normal life cycle of a cell, as it were, where the cell is almost born, it becomes a hair cell or a brain cell or a breast cell, and then after a period of time it dies. These cancer cells just grow and grow and grow until they get bigger and start affecting other parts of the body and taking over control of those parts of the body. And that's why you start getting the function of those organs breaking down. So when a patient has cancer, it's already a very difficult and shocking diagnosis for them. And it actually feels like you've lost control of what's going on in your life. You thought you had, quote unquote, a contract with your body, that you behave a certain way and your body behaves a certain way. And then out of the blue, you're getting this shocking diagnosis of cancer. And it's extremely frightening. So I think this theme of being united by unique and patient-centered care is excellent and very important, because it helps the patient go back to being an individual. It helps them go back to being empowered, because we don't just do a one-size-fits-all cancer treatment for all patients. We look at the patient, we say, this is the specific subtype of diagnosis you have, but also this is the person you are. These are the needs that you have as a mother, as a father, as a child, or whatever. And we try and say, how does our treatment plan align with who you are as an individual, and let's try and make your treatment unique to you. And that empowers the patient and helps them sort of get through the cancer journey a bit more easily.
Well, and nowadays there's much more individual kind of treatments available. I know that a bit about diagnosis. I don't know if you can share with us the issues of the uniqueness, shall we say, in diagnosis, and how that leads to uniqueness in treatment.
For sure. So when we're talking about any kind of cancer. Like I said before, it's not one size fits all. So we often have to subdivide the cancer into different groups to know which treatment would work for the patient. So for example, if we look at breast cancer, first and foremost, the treatment you give for breast cancer is not the same treatment you would give for bowel cancer, for example. But even within breast cancer, you then have to find what is driving that cancer uniquely. Sometimes in breast cancer, it's being driven by hormones like estrogen and progesterone. Sometimes it's being driven by a protein that's produced in the body, not a protein you eat, but a protein that's produced in the body called HER2. Sometimes it's being driven by none of these. So whenever a patient gets a diagnosis of a cancer, we need to find what cancer we're dealing with, then find what subtype of cancer we're dealing with, so that the treatment we give that patient is targeted specifically for the unique type of cancer they have and the unique protein or hormone or whatever it is that is driving that cancer. So it's a very targeted, specialized form of treatment that we're aiming to give our patients.
That's critical. So Dr. Ekpo, coming back to you, you run the NSIA, which is one of the biggest and the largest in the country, cancer centers. How does this concept of united by unique, how is that going to change how you run the place, or is it going to change the way you run the place? Does it have an impact on what it is you do?
Oh, yes, certainly. One of the things that we have done in the cancer center here, I mean, it's not just the focus on the kind of treatments, the technical side, but even the realizing the individuality of each patient. We have support groups which are gender-based, realizing that each patient will struggle with different things. Some struggle with their sexuality. For example, a breast cancer patient who has had a mastectomy, the body image concerns, need to be addressed. You have chemotherapy and you lose your hair. So we have support groups that are gender-based, and the patients can sit and get the support that they need, learn that they're not alone in their journey, hence the united part of the theme. So you're sitting with other people who are going through the same thing as you, and you feel a little less alone. Because yes, the oncologist has seen, so many patients with cancer, and they know the drill, they know what to give. But it's different when it is you've seen someone who is going through the same thing as you from a patient's angle. So we have that in the center. We also have for each patient that comes to the center and is going through treatment, they have 2 complementary psycho-oncology visits, because we realize that it's not just all about the treatments, either the radiotherapy or the hormonal therapy or chemotherapy that the patient is receiving, but what is their state of mind. A lot of times disease, whatever the disease is, and certainly even it happens even more with cancer, disease sort of dehumanizes a patient. Medical personnel can be a bit guilty of this way. So that breast cancer came in, or the malaria came in, or the appendicitis came in. And then you forget this is a human being living and breathing with feelings, and they're somebody's mother or child or, husband or wife or whatever. But when the psycho-oncology visit sort of helps, psycho-oncology visits, we assess them. There's a distress thermometer when they come in, and we assess their level of mental distress. How are they coping with this whole diagnosis? And then you're able to sit with the psychologist before you start treatment and then after. So you've had the treatment and, oh, I was so afraid before I got onto the machine. It was going to be frightening. It was going to be painful or terrible. And then, oh, you've done it. How did you feel after the first 1-2 sessions? Do you have anything you want to share? So we constantly work around the patient, introducing areas of supportive care such that the patient is supported. That's the goal. Treatment that is supportive, that recognizes the individuality of each patient, the struggles that they face as individuals, and we're able to address and support them as they receive treatment with us.
I mean, that's wonderful. I mean, in December, I was at the Cancer Survivors Conference, and that was one of the critical areas in which they all said they needed support. A very important area was, for example, the issue of fertility. Some of them are young people, some of them want to have children. And it was never mentioned to some people that they could do things like egg freezing. So, for example, at that conference, I was telling them for the first time that the Bridge Clinic could provide egg freezing facilities. So understanding that different people are at different levels or different paths of on their journey in life. And some people who have cancer need to know before they start treatment. There's things like this issue of egg freezing or sperm freezing, so that they can have a family, because cancer is no longer a death sentence. and they can live normal lives afterwards. I think some of these things are so important. So, Dr. Iwuji, how are you going to implement this issue of united but and unique in your own cancer center, the Lakeshore Cancer Center?
So at Lakeshore, we try and look at it from a number of different angles. First and foremost, we've spoken about the oncology side in terms of the treatment that is specific to that patient. So making sure that all of our patients that come through Lakeshore Cancer Center are discussed primarily in a multidisciplinary team meeting, so that we're looking at their cancer and breaking it down to the subtypes and make sure we're offering them the right treatment. And then I'm using the word offering very deliberately, because giving them the options of what works best for them, okay, or at least giving them the option of discussing what they would prefer to, what treatment they would prefer. Some patients might, you might be offering them a treatment whereby they have to come in every week. And that might not go well with their schedule if it's a mother who has to be picking her children up from school, for example. So we really have to make sure that what we do at Lakeshore is ensure that it's a discussion. What your treatment plan is a discussion. That's the first thing. The second thing is exactly like Dr. Ekpo was saying. We're really trying to make sure that we offer our patients support. So support with other patients, in terms of our support group, and also helping them with the financial side, because we know that finances are a huge issue in cancer care. So we want to make sure that our patients that come to Lakeshore are financially supported by putting them into clinical trials, for example, when we look at financial toxicity for these patients. So we're trying to look at our patients from a holistic angle, not just the cancer patient, but how is this treatment affecting your home life, your psychology, your finances as well. So we're trying to just make sure that our patients get a holistic care package.
Thank you. Thank you very much. Thank you so much, Madam, for coming on the program to share your experience with us, Madam Ethel. Can you tell us what happened? How did you discover you had cancer? And what has been your own unique journey? Can you share it with us?
Okay. Thank you so much for the invite. My name is Ethel Olomu. I'm a stage 4 breast survivor. By March, I'll be 15 years post-survivor. So, in 2010, we didn't know it was cancer. I just had like a pain on my breast. My mom is a retired nurse, and I went to the hospital. It was lump. From lump, they removed the lump and, took it for biopsy and everything. It came out, very clean, sparkling clean, and nothing was wrong with me. But weeks after that, where they did the biopsy, took the sample, I just started swelling or bringing out fluid, pus, and blood. Even at that, nobody was even talking about cancer. That went on for like more weeks, months, and everything. And of course, I had to go back to the hospital, in and out of the hospital. They were taking various samples. Still, they weren't seeing anything. In fact, I did like almost 5 surgeries because, the breast was just leaking, getting swollen and everything. The blood won't stop coming, the pus and everything. Not until it took us almost a year of back and forth from the hospital to the tradomedical to all sorts of concussion to all kind of treatment, because in fact, everybody was just experimenting with whatever they feel. We'll have to reduce the swollen and the pus coming out and the blood coming out, gushing. So almost a year before my sample was not taken abroad. By this time, this sample was taken to literally all the big labs and states from Lagos, Ibadan, Abuja, everywhere. And it was coming out very clean, benign, nothing was on it. So it was coming out benign. Nobody was talking about cancer because it's not cancerous. Nobody was saying it's cancerous. Not until the sample was taken outside Nigeria. And when it came back, they were like, oh, this is the last stage of cancer that has spread to vital organs and everything. And I was just given 3 weeks to live. And by then they were like, oh, don't even bother making an arrangement to fly her anywhere to treat her because it's really, really bad. And by this time, I was actually bedridden because the breast was getting bigger and bigger. The fluid was coming out nonstop. I was bedridden. I had bed sores and everything. But of course, we didn't give up. We were still like, still asking questions. Still
so
like
did you go for
because,
treatment? Yes. So what treatment did you have at that time?
Yes, finally I went for treatment. It was actually a particular doctor that came from US then that was the only one that accepted me because the case was really, really bad. It was not the report. When he accepted me, he didn't even really give me hope. He just said, oh, let me just make your passing peaceful, just keep you. And of course, he placed me on the blood transfusion for like 6 weeks because I was, my immune system was really down and everything. I was finished and everything. And by that 6 week, he just saw that there was kind of life coming in me. I did chemotherapy. I took 6 sessions of chemotherapy. I did that. Of course, I did my mastectomy. That was really compulsory because the breast was already rotting. I did all the treatment and everything. And by the grace of God, this is like 15 years. We are here today. I'm
Fantastic.
still alive. The 3 weeks has passed
Thank God.
years ago, and I'm still here. So that's actually my journey. And because I had the doctor I had was a very, very, good doctor that was really, really, he was really, really, when I mean he was very, very vested and interested in my case, because even when I was taking the chemo, there was this communication, patient provider communication was really top notch with him, because we're like, when you take this chemo, this is how you're going to feel. Your emotions will be there. You're going to have heat flashes. He told me everything I will be experiencing, all the side effects I will be experiencing, and how the treatment will go until till today. We still have that relationship. Like, even if it's midnight, whatever I'm feeling, and I call him, he responds to me and he tells me what to do. And for these past 15 years, I've not for one day stopped going for my routine medical check, because it's very compulsory. I went from, 3 months, once in 3 months. I graduated to 6 months in 6 months. Right now, I'm in my yearly routine check, which is like very, very compulsory for me every year.
Fantastic. Thank you very much for sharing. Thank you so much for sharing that. And I think it is wonderful. And I think everybody who has heard clearly is that 15 years later, you are fit and well. So we thank God for the doctors, thank God for the treatment that made you, successful, and the fact that you are here with us. So thank God for that. So Dr. Iwuji, I don't know if I can ask you about the social cultural issues surrounding cancer care.
Yes, I think it's very important that we discuss this, because we all know that in our society, that cancer is like, the C word is so terrifying, and everybody thinks that once you get cancer, it's a death sentence. And we cannot reiterate enough that cancer is not a death sentence. And
I think Ethel has demonstrated that it is not a death sentence. So we thank God for that.
And I'm so grateful to Ethel for coming on the show and being so honest with her story, the journey that she went through, because too often we have patients who come to us and we're trying to offer treatment, chemotherapy, and understandably they're terrified because they've heard one story of someone somewhere that had chemotherapy and had a terrible experience. And that's where the uniqueness comes in. Yours, just because that was their story doesn't mean it will be your story. And, if you're going to pick a story, then pick Ethel's story, the story of someone who survived the cancer. So, she was in a bad way. She was, like she said, had bedridden, but she managed to recuperate with the blood transfusions, have chemotherapy, and she's alive 15 years later. So I just want to say, socially and culturally, even for those of us who are trying to support our friends and our loved ones, please, let's remember everyone is unique. Just because one person has had a bad story doesn't mean it's the story for everybody, and we should be encouraging our loved ones and our friends to really get the right treatment.
Thank you, Dr. Ekpo. So, and from your perspective?
Yes, I mean, Dr. Iwuji is so right. We live in a very communal environment, and patient stories are shared. So somebody tells the next person, this is my experience, and that becomes the norm. Everybody just holds on to that. And it is for that very reason that at NLCC we're so focused on telling patient stories, recounting stories of people like Ethel, who were given, they had a cancer diagnosis. How did they go through it? Because I mean, the power of shared stories is cannot be overemphasized. You're seeing somebody else, you're seeing it live and direct, and you understand, oh, if this person could do it, then there's hope for me. So
if she could survive a stage
4,
she can survive
stage 4. If they had got all the organs, she was bedridden, the foot was leaking and all of that. She's done a mastectomy, and she's still fine. So if that can happen with her, so those are the kind of stories we should amplify, like Dr. Iwuji has said. Let's take Ethel's story. If it happened for Ethel, it can happen for me. Than taking the negative one. Well, if chemo went bad for this person, it means that's what's going to happen to me.
I think that's important. I think it is just so important that we actually push and understand the outcome and have a positive perspective on the outcome and know that you are unique. And so what has happened to other people may not necessarily happen to you. You need to go forward on your journey with that positive expectation and hopefully having that positive outcome. So talking about the World Cancer Day, the 4th of February coming up, what plans has your own organization made around this time? Is there anything you'd like to share with the public?
Oh, yes. As usual, as
Dr. Iwuji.
For me,
Yes,
right?
so
Okay, so oh, sorry.
So for at Lakeshore Cancer Center, we are, I know it's World Cancer Day, but we are going for the whole month. So we are offering 15% off our screening tests for cancer. So that's 15% off PSA, fecal FIT tests, which are for colorectal cancer, liquid-based cytology for cervical cancer. And we're also offering free clinical breast exams and baseline tests. So things like your biometrics, random blood sugars, and a consultation on your screening results.
So people should just come in.
Yes,
come in and see. Now, unfortunately, we have just a few minutes left. So I don't know, Dr. Ekpo, if you have any last words for our listeners.
Yes, so I mean, to mark the World Cancer Day, it's a month-long event for us. Our wellness clinics are open, where people can walk in and assess their cancer risk. It's a very tailored, unique, and individualized approach. So it's not just, doing a bunch of tests, but you actually sit with a qualified oncologist who will assess your risk and take history and do a proper exam. So we're offering
this is at the LUTH Cancer Center. Yes?
Yes, NSIA-LUTH Cancer Center, correct. So, I mean, the general public can come in and have those tests done and assess their risk.
Okay. So, Doctor, if I can just give Ethel, usually, the opportunity to say a few words to people, to women out there who are listening, who maybe have had a diagnosis or afraid or thinking they may have cancer. Do you have any words you can say? Any words of encouragement for them?
Yes, I will always tell women that if and when you're diagnosed of cancer, first of all, as the doctor said, and which I know, cancer is not a death sentence. At least from my case, you know that it's not a death sentence, because even when I had the medical report that I had 3 weeks to live, I didn't give up. I fought. Like, cancer is about fighting. You just have to fight, no matter the pains and everything, for our women to accept treatment. Because I know that immediately you go to the hospital and you're diagnosed of cancer, our women just run away. Most times they run to the church. Most times they just run and, just want to be by themselves. They lock up, they shut out everybody. They are just, in this depressed mood and everything. But all I would tell them, accept treatment. Go for treatment and let it be that you did all you can and see if you're going to die. And also be very hopeful. Hope is one thing that will make your treatment to work. Hope, be prayerful and everything. Take your medication. And don't just do self-medication, because a lot of them too, by the time you go to the hospital, especially I always tell people that have a lot of information about cancer are people that don't have any business with cancer. They've never experienced it. They are not the doctors. In fact, they know nothing, no education, no awareness about it, but they are that will tell you, oh, chemo kills, chemo does this, chemo does that. And I always tell them I took 9 sections of chemo. And of course, it had this side effect, but I still took it knowing that this is what will fight the cancer. So why should I leave it and be taking because I tried, if you ask to try, if you're talking about all the things they've tried, I tell people that I've tried everything. During my treatment time, I tried from the native to the English, to the supplement, to the everything. I experimented with everything. And at the end of the day, I went the chemo out. So to tell you that chemo for now, that is what we know that will cure cancer. So why would you want to go around when you know that at the end of the day, you come back to the hospital, even when they come back, it's already late. They come back when it's the last stage, stage 4, something that the doctor already told them when it was stage 1. but they decided to disappear, doing all sorts of, some of them will do therapy, some of them will say food, they just try all sorts of supplements, and they waste money, waste time and everything. And at the end of the day, by the time they are coming back to the hospital, it's late, it's no longer treatable, and they lose their life. Because if from beginning, they actually accepted treatment, would have a lot of women alive today. But because they didn't accept that, because of all the things they felt and everything. So accepting treatment is key. And also learn to speak up. A lot of us, when you are diagnosed of cancer, would think is something of secrecy or is a taboo or something. They even don't want to tell people that live in the same house. It's something I've experienced. Like a friend, the sister had cancer for almost a year. She didn't tell anybody. She was going to work with her leaking breast. She would wrap up, pad up everything and go to work. Not until the day she passed out on the street. And they rushed to the hospital. Behold, she had the doctor said, for 2 years now, I gave her this diagnosis and she disappeared. Nobody in her house knew. So we have such cases where the women just lock up. But always tell women, speak up. We know there's stigma. If it's stigma, of course there's stigma. Didn't I go through the stigma? I went through the stigma, but I still decided to fight because I love my life. I wanted to be alive in spite of the doctor's report. So learn to speak up and also learn to ask for help, which is very, very important because no one can fight cancer or treat cancer alone, no matter who you are, because cancer treatment is quite expensive. The only thing people will tell you is no, but did you ask? By the time you ask 10, 20 people, at least you see one person that will like, okay, I'm going to support you with my little widow's mite. But you know how some people just keep quiet and everything. And I also encourage people, when your friend or relative is diagnosed of cancer, just the same way we come out to do we do fund committees for Ashebi and burial committees and do contributions and do fundraising. Can we also do that for our friend that is alive, that is battling cancer, so that the person will not die? So that is where speaking up is important, and telling your family. And I am alive today because during my time, my family, I was surrounded with too much love and care. Like everybody just literally moved into my space, like they were watching me 24/7. That is very, very important. Love and care, support from family and friends, very, very important, because that is when you need it the most. So people should reach out to family, and family should also do that.
This has been wonderful. Thank you so much for sharing this. I know it will go a long way to reach a lot of people. Thank you so much. God bless.
Thank you for watching. Please like, share and subscribe for new video updates.